Hello, I'm Daniel Browning. Welcome to this program about Aboriginal and Torres Strait Islander health workers, a valued profession, cultural expertise in the health team, coming to you on the Rural Health Channel. And on behalf of everyone here, I'd like to acknowledge that this program is being broadcast from the land of the Wongal people of the Darug, traditional custodians, and we acknowledge their elders, past and present. It's well documented and recognised that Aboriginal and Torres Strait Islander people suffer poorer health outcomes and a shorter life expectancy than non-Indigenous Australians. Contributing to this are the barriers they face in accessing culturally safe healthcare. Aboriginal and Torres Strait Islander health workers play a unique and valuable role in overcoming these barriers. However, their role is not often well understood. Recent reports highlight that we're not realising the full potential of this workforce to help close the health gap. And this program will explore some of the reasons behind this. We'll hear the panel's personal experiences of why it's so important to have that cultural expertise in the health team and how it strengthens interprofessional relationships and has a positive impact on health outcomes for Aboriginal and Torres Strait Islander communities. This is a professionally accredited program from the Rural Health Education Foundation, broadcast on the Rural Health Channel. It's also being broadcast simultaneously via a live online webcast and on NITV. As with all of our live programs, we'd love to put your questions to the panel. You can get in touch by phone, text, email or fax. The details are on your screen now. So send your emails to questions@rhef.com.au. And you can text us on 0408 408 932 or phone us on 1800 817 268. You can also fax your questions to 1800 633 410. And if you're watching via the webcast on your computer, type your questions into the live talk box and click submit. We'll be taking questions live throughout the panel discussion, so please send them in as they arise. And the first poll question tonight, it'd be good to know who's watching us tonight and to let us know what profession you belong to. Are you an Aboriginal or Torres Strait Islander health worker or practitioner? Are you a nurse? Are you a GP? Are you a pharmacist? Do you work in allied health? Are you a specialist? Are you a student? Are you a manager? Are you an employer? Or something else? Now it's time to introduce our panel. Jenny Paulina is a Nigina woman born in Derby in WA. She's a senior Aboriginal health worker and is currently senior manager at the Centre for Aboriginal Primary Healthcare Training, Education and Research at the Kimberley Aboriginal Medical Services Council in WA. Jenny is also chair of the National Aboriginal and Torres Strait Islander Health Worker Association, or NATSIWA as we know it. Angela Dufek grew up in the Adelaide Hills and is a registered nurse and midwife. She has a master's degree in rural and remote health and has worked as a remote area nurse in the Kimberley. She's been at Port Lincoln Aboriginal Health Service for 12 years and is currently the Senior Manager of Client Services. Peter Panqui has been an Aboriginal health worker for over 30 years and is currently the Principal Aboriginal Health Worker Advisor for the NT, the Northern Territory Department of Health. He's chair of the Aboriginal and Torres Strait Islander Health Practice Board of Australia and has been involved with Aboriginal health worker regulations in the NT for over 14 years. Peter's also been closely involved in developing the National Aboriginal and Torres Strait Islander Primary Healthcare Qualifications. Rita Williams is Aboriginal Health Education Officer at the Children's Hospital at Westmead in New South Wales. And Rita was responsible for setting up the RDAC study into renal disease in Aboriginal children. She comes from Tingha in northwest New South Wales, and she's worked in Aboriginal health for the past 35 years and is chair of the Aboriginal and Torres Strait Islander Health Worker Forum. Last but not least, Professor Richard Murray is a GP and Dean of Medicine at James Cook University in Townsville. He's also President of the Australian College of Rural and Remote Medicine. Richard spent 14 years working in the remote Kimberley region of WA, and he's been directly involved with Aboriginal health worker training and the development of the national qualifications and competency standards. Welcome to you all. We'll get straight into it, Jenny, and I guess it's really important at the outset to define what we mean by the Aboriginal health worker, their role, what do they do?
The role of Aboriginal health workers are very vast, depending on what area of the country that you live in and where you work, and it can range from working in a clinic or working as in a hospital system and a range of other things. And the main role, though, is working in primary health care within the community for our people, and I think that's why it's so important that we have Aboriginal health workers.
There's a very broad scope of practice. I mean, they do a lot of things.
There is, yes, Daniel. And that broad scope of practice is, we've recently, developed a professional framework for Aboriginal health workers, which again is broad because it's around understanding what people know, understanding what skills they have, and therefore putting that into place.
And that professional practice framework, there's some very key principles. I think the core principle at the heart of it is culturally safe environment.
Yeah. So providing that culturally safe environment for our people when they're accessing health services, and delivering healthcare in a holistic way, the whole way, and remembering that all our clients are part of a community. And it's very important that we look at the whole community, and also to be able to provide leadership and to provide being a role model for other Aboriginal people who may be thinking of going into Aboriginal health. Yes.
And Peter Pank, we're going to encounter this difference between the practitioner and the health worker. Can you maybe draw a line between those two different occupations?
Yeah, sure. First of all, there is Aboriginal health workers. And within that workforce, there's the Aboriginal and Torres Strait Islander health practitioner. And the practitioner role is a registered practitioner, registered under national legislation. There's 14 other health professions in this category, from nurses and doctors and dentists and all the rest of them. The Aboriginal and Torres Strait Islander health practitioner have specific training, the clinical training that they have. They can use medication and assess clients and have a more in-depth clinical aspect to their work. That doesn't make them any different to, I guess, the Aboriginal health workers who do the community work as well. I mean, the health practitioner does get out there in the community and work in that primary healthcare model, but trying to match up that clinical practice along with the primary healthcare role in the community.
Just on that issue, Jenny, because your expertise is in education and training for our health workers. What's the training that they undergo?
Okay, so it's what we call VET training, so vocational education training. So it's a skill-based training. So the National Aboriginal Health Worker Training Package actually starts at the Certificate 2, which is like a vet in schools. It's a bit of an introduction for young people to, if they want to get into Aboriginal health from the schooling area. And then they go into a Cert 3, which is the employable certificate at the moment. And this is where they learn to have basic health assessment skills, knowledge around anatomy and physiology, and about being part of the team, right through to the advanced diploma into primary health care, which could mean that people could be advanced clinicians. It could also mean that Aboriginal health workers would be able to manage and go towards management.
We'll just get some results from our first poll question. Who's watching this program tonight via our webcast? Aboriginal or Torres Strait Islander health worker or practitioner, 9%. Nurse, 46%. GP, 9%. Pharmacist, no pharmacists, no people in allied health. There are 9% of students, no specialists. There are 18% managers, no employers, and others are 9%. So an interesting spread in our audience. And poll question 2, we'd like to get an idea of where you work. Is it in a remote community or an urban setting? Metropolitan, regional, rural, or remote? Now, this this whole question of national registration, Peter, can I ask you, is it the same across the country? Because that's part of your role on the board.
Yeah, look, national registration is as the name suggests, it's national. There's one legislation, and the legislation is the same as for doctors and nurses as well. There is a national board that develops standards and guidelines for registration of this workforce. The training, first of all, it's the Aboriginal and Torres Strait Islander Primary Healthcare Cert 4 practice. There is a process where registered training organisations, or RTOs, will be accredited by the board, and the qualification has to be accredited. So there's a set standard around that, and it is a national scheme.
Are they pretty rigorous, those standards? I mean, what's needed to register?
Yes, they are pretty rigorous. I mean, we have to make sure that they are rigorous because, the main aim of registration is protection of the public, protection of the practice that Aboriginal health practitioners undertake. So we have to make sure that it is rigorous and that, the standard of training is right up there for that safe practice.
I guess it's really important to know what kind of numbers, Jenny, that we're talking about. I mean, there aren't any concrete numbers, are there?
No, not. We know that there is about 300 registered health practitioners, but it's been very slow. The uptake's been very slow of Aboriginal health workers becoming registered. And offhand, I think there's probably only about 1,800 around the country altogether.
And the uptake has been bigger in places like the Northern Territory and Queensland, where there's an established system, I suppose, a system that's been operating for a long time.
Yeah, absolutely. Part of the national registration, part of the National Act was that for health professionals that had already registered boards in those states and territories were automatically rolled over into the national scheme. And of course, the Northern Territory was actually the only state and territory that had a state registration for Aboriginal health workers. So the bulk of those registered practitioners are actually in the Northern Territory.
It's important to note that the Northern Territory... Yeah, Peter.
Yeah, just a point on that. We have had registration for Aboriginal health workers for 27 years until the 1st of July this year when it went national.
Yes, the Northern Territory leads the way in terms of national registration. Now, here are the results of our second poll question. They're coming in thick and fast on whether you work in metropolitan. 10% of you work in metropolitan areas, 10% work in regional, 60% in rural, and 20%, nice figure, in remote areas. Now, poll question 3, we'd like to know the sector you work in. Now, is it Aboriginal community-controlled health? Is it general practice? Is it community health? Is it hospital? Is it private practice, or is it something else? Now, the next part of our discussion, why, Jenny, do you think Aboriginal and Torres Strait Islander health workers, why are they so important?
Aboriginal health workers are so important because they provide culturally safe health care for Aboriginal people accessing health services. And so that doesn't matter where they're going, there needs to be Aboriginal health workers in all of those health sector areas.
And Rita, can I bring you in here? What do you think it is that the Aboriginal health worker brings to a team?
They can break down the culture barriers, especially on access to mainstream services. And in a sense, a typical day can happen almost with anything. Families arriving 3 weeks ago on my door, as soon as I opened the office, and said that they had referrals to the specialist. They said they had appointments, and they said they had accommodation. They didn't have any. They didn't have any of those, and so what I did was, first thing was got on the phone and rang the specialist. I don't ring their secretaries, I just ring their specialist. And straight away we had an appointment, 2 appointments, theatre appointments, but because they weren't patients at that stage, the child wasn't a patient, so therefore they're not eligible for accommodation. So luckily they had a family that they stayed in. with over the next 3 days because we weren't able to get them an accommodation into the hospital until 3 days later. So there they stayed. The child went to theatre, and actually today they went home with success. And I've already booked their accommodation for in 3 months' time, and also we have appointments and we have theatre dates as well.
Good result, good result. I mean, it gives you a sense of the kind of breadth of the role, the diversity in the role. Peter, what makes our Aboriginal and Islander health workers so unique? I mean, those cultural barriers that need to be overcome for our people to access the healthcare that they need.
Yeah, well, it's about the cultural knowledge, but also the networking with the families. They know the families well. The language skills, often in a lot of our remote communities, there are language skills that the other health professions don't have in a lot of cases. Community knowledge is a very strong thing, but also they do have skills. They do have skills around the health services, and they know the health services. I mean, it's not just the doctors and nurses who know this stuff. I mean, the health workers in those communities have those clinical skills and have the knowledge. They know the system. They know when to refer. They know when to involve family. Sometimes you need to involve other members of the family. They know when to do that, and they do it really well.
Richard, as far as you've been able to observe, what kind of impact do they have? In not just in terms of access, but broadly, what kind of impact do our workers have?
Well, I guess in terms of formal studies, there have certainly been a number of studies. I can think of, for instance, impact of health worker-led medication and chronic disease management on death and kidney failure, for instance, in one top-end study. Other things which tend to be a bit disease-based, ear health, eye health, and so on. I think beyond that, it's just a really good model of comprehensive primary health care. The rest of the country has a lot to learn. Having a really solid base of people who are deeply connected with community and family, who have understanding of what the dynamics are, the causes of health, the determinants of health that operate locally, what needs to be done in addition to recognise when people are really serious about something or not so serious, where you might draw on resources. And I can say from years of experience that there is no way in which my work would have been as effective without working alongside, learning with, learning from and teaching Aboriginal health workers. There
are some myths and some misconceptions, and I'd like to hear you perhaps kind of outline some of those, because they're quite key, and we can't get further into this discussion without perhaps confronting those.
I think that's probably right. I guess the things that many of us have struck over the years have been misapprehensions about what it is in clinical care that might be legal, if you like. And so, for instance, people worry that perhaps making an assessment, getting a history, performing a physical examination, collecting a urine specimen, taking blood, performing a pap smear, taking genital swabs, for instance, that somehow there's some law that makes that, only certain classes of professional can do these things. That's actually not true. There are certainly employer policies, but they're employer policies. There are certainly custom and practice and what people might think as a medical duty or a nursing duty or whatever. Actually, none of that's got anything to do with the actual reality of the legislative framework in which we work. And look, the truth of where we're going with healthcare teams is that we need to just lose a lot of this nonsense. Get used to the idea that everyone brings a particular expertise to the situation, and that everyone's expertise is evolving and growing every day. We learn with and on our patients, and if somebody's showing aptitude, has a base amount of training, showing aptitude and interest in something, and is able to demonstrate they're performing a task proficiently, well, they can do all of them from now on, as far as I'm concerned, and call me when there's a tough one. And I think that's the way in which you get effective healthcare teams working to the top of everybody's licence at all times in a way that's most responsive to the community.
Yeah, I used to get asked about what can Aboriginal health worker do. Yeah. This is back in the NT, and our response was they can do whatever they're trained to do, and right. Within the guidelines and your policies and. and that of your...
I mean, one of the only bits of law, I suppose, Peter, is the poisons legislation and so on, and actually, mostly that's not a big issue. How have you found that in the Territory?
Yeah, look, in the Northern Territory, I mean, we have legislation, the Poisons and Dangerous Drug Act, which allows Aboriginal and Torres Strait Islander health practitioners to possess and supply medication. It's through a gazettal order under that act, and they're able to do that effectively. But it's not just the using the medications. It's about the processes before that, and learning how to assess a client. You know, do the observations, do all those things, and then make a clinical judgment on what they should do. I mean, it may not be medication, it may be referral to another person, to another health practitioner. So that's the training that our practitioners have had.
Mm-hmm. Well, a key focus for Aboriginal health workers is improving access to health services for their community. Let's see how one group at Norlunga Aboriginal Primary Health Unit supports this through their regular Nunga lunch.
Hey, it's Malcolm.
Yeah. Hey.
You do it. Bigby sorted that out for you?
Yeah, well.
The reason why I got into Aboriginal health was because I got sick and tired of seeing family members and community members dying at young ages due to a lack of education and just not being aware of diseases and disabilities that they have.
The whole team on a Wednesday are in attendance, and that's an opportunity for the community also to touch base with the health workers, to speak to the health workers and get information on some of their health issues, you know, health information that they like to know about. So we promote that at all times.
That's a good thing about eating.
Yep.
You haven't been diagnosed with type 2, you've been diagnosed at risk of getting type 2.
Yeah, well.
I've known even since I was in high school that I wanted to be an Aboriginal health worker.
I run health sessions and presentations on diabetes, heart disease.
Oh, that sounds good, Joel. I'd be really interested in that.
Great innovation down there at Norlunga with the Nunga lunch. Peter, if I could ask you, I mean, I think the clip illustrates one of the points that we're trying to make, and it's about how Aboriginal health workers can improve access, can get our people into care quicker. Do you have similar experiences? I mean, is something like that you've seen up in the Northern Territory?
Not quite like that one, but there are other health promotion type programs and ways of getting people involved in their own health. Mm. And I think that's a good example of a program that allows, I guess, the community to get involved with it. You know, the health worker going out and picking up people and going into the workplace and doing the health promotion things and with the those sorts of practices. I think it just describes the diversity, I think, of the role of the Aboriginal health worker and Aboriginal health practitioners.
Now, Jenny, there's an experience you were talking about at Bijadango, just getting fresh food into people's mouths. I mean, that's as important as it is. That kind of thing, improving access.
Absolutely. Daniel, as part of the Certificate 3 in Aboriginal Primary Healthcare Training, we teach about nutrition and good nutrition and the basis of nutrition. And one of the things that we have to do is that we then go into the community store and we suss out what foods are there and what's good for you and what's not good for you. And it was really quite a shock for me when I realised that the community doesn't actually have good access to fresh food all the time, and it's very expensive. And, you know, if you eat lettuce and tomatoes and cucumber and things that they tell us is good for you, it doesn't keep your tummy full for long. So therefore our people are often, you know, because there's such poor social structures and stuff like that, that they often have to buy, you know, flour, which is what keeps your tummy full, which of course we know that, you know, processed carbohydrates leads us down to ill health if we continue to eat bad foods.
Now, a question to you, Angela. What's been your experience working with Aboriginal and Torres Strait Islander health workers? You've had quite a long experience. Tell us about
I guess in the beginning when I was remote area nursing, the Aboriginal health worker was often considered an ancillary or an aid to the nurse, whereas I'm really pleased to say that's changed now. They are the connection with community that everyone has mentioned so far, and the Aboriginal health workers are so valuable in teasing through a lot of the social issues to get to the medical problems. You know, traditionally nurses and doctors go straight to the medical problem, which we know is very important, but you've got to tease through a lot of social problems first before you can get to the medical problems.
And can you pinpoint what difference it's made to the way the team works and to achieving those good
it's a mutual
outcomes?
respect. So it's encouraging the non-Aboriginal health staff, and by that I mean nurses, doctors, and everyone, respecting the knowledge and the capacity that the health workers have to provide that care as well, and taking it, not only teasing through the social problems, but then, as Peter's mentioned, actually doing the clinical examinations and that as well.
To trust them.
Let's look at another clip now and hear from Aboriginal health workers at the Karpa-Narratendi Aboriginal Health Unit at Flinders Medical Centre about their role working with patients
It's a big thing.
in a hospital environment.
If you've never left your community.
I'm going up to see Natalie. Okay. Our job is to look after the Aboriginal patients, but also advocate on their behalf, because Aboriginal people are very shy people. You know, we don't like to look at people, we don't like to talk to non-Indigenous people, especially in a hospital like doctors and nurses. So Aboriginal health workers are very important. I'm here to see Natalie.
Yeah, she's in bed number 9.
Thank you.
Problem with my heart.
Problem with your heart. So did you have that procedure yesterday?
No, today.
Today.
When they're in the hospital, then the liaison workers visit them on the wards and then liaise with doctors and nurses about cultural aspects that they might need to think about.
Now you're going to have your angiogram, artery. Okay.
Today.
Okay.
I came down for this.
Yes. Do the angio, maybe put a stent, put the balloon.
Yeah.
Yep. I was just letting her know what sort of procedure she was having, whether she understood what she was having, and whether she was happy about having it. And then you'll fly home after 5 days.
After 5 days.
After 5 days, after the stent, yeah. So you've done really well, Natalie. Because I remember you wanted to go home the first day you came here. I'm passionate about this job because Aboriginal people die, 17 to 18 years before non-Indigenous people. I just want to make a difference, even if it's a small difference.
Some good work being done at Karpa-Narratendi. Now, Rita, you would have encountered some of those issues that we just saw in the clip. People wanting to get out of hospital as quick as possible.
As quick as possible. from the time they arrive, Daniel, in a sense. But whilst they're there, they also play a very important, role in their child's health and encouraging them to be at every consultation and be, in ward rounds when doctors actually deliver the information. And if they have any further information or questions to ask, I encourage them to think about it. Like if you don't think about questions now, write them down, but next time they visit the ward, then they may have some other questions that they might need to ask.
Richard, a question for you. What evidence, I guess we always come back to evidence, what evidence do we have that Aboriginal health workers, positively affect patient outcomes?
I guess I've mentioned some of the issues, specific disease-based or condition-based studies. I suppose more internationally, what's really clear is that access to primary health care can be positively correlated with health of populations. And that's in contrast, say, for instance, to the density of specialist medical practitioners to population, which doesn't so much reflect population health. So there's some very important international evidence, and certainly on the basis of often specific conditions being better managed. Chronic disease is a classic example. Prevalence of chronic disease, Aboriginal and Torres Strait communities, typically 30-40% of adults will have one or more chronic conditions. And that just puts a whole different flavour on the challenges of communication, Rita, like you say, and how you go about organising the care. And honestly, without that broader primary healthcare team, it just is not possible to do really effective work.
Angela, can I ask you, you've been able to see how Aboriginal and Torres Strait Islander health workers operate. In terms of improving access, in terms of getting people into care, what difference have they made?
Well, again, they provide that access to the clients, to the community. They can actually go out into the homes, bring people into the service, or take services out to into the community as necessary and as appropriate. Identify issues often before they flare up and become worse, and are very important, cogs in the whole care plan, care management of a client.
Jenny, I have to ask, there seem to be very many different job titles. We were talking about registration versus, other ways of becoming a health worker or a practitioner. Do you think there are maybe too many titles?
I think perhaps, if we have the two titles, Aboriginal health worker and a registered practitioner as part of that Aboriginal health worker profession, and I think that our job roles will always be varied depending on where we're from. But it's about community, and it's about community's expectation of us as Aboriginal health workers. I mean, an urban community may not have the same expectation as a remote community of their Aboriginal health worker. And I think that's the really important thing, and why there needs to be diverse roles, although there's more specific roles and responsibilities around a health practitioner.
Because Aboriginal and Torres Strait Islander health workers are in and of the community, aren't they?
Absolutely.
We can't lose sight of that point.
No, absolutely. And I think that's the key thing. When we're recruiting Aboriginal health worker students, for example, one of the key questions that we ask them is, do they have their community's support? Because we know that if the community's not supporting people to come and do their health worker training, then when they go back, they're not going to be supported when they go back. And so it's about that whole cog of community and being part of community and why it's so important.
And here are the results of our last poll question on the sector that you work in. Well, 6% of you work in the Aboriginal community-controlled health sector. 28% of you work in general practice. 16% in community health. 6% in hospital. 17% in private practice. And the rest of you, 27%, work in different fields. And poll question 4, do you think the team you work in fully values the role of the Aboriginal and Torres Strait Islander health worker or practitioner? You can opt to say yes, they are an integral part, or you can say not fully, they are in the team but they're not utilised to their full potential. You can say no, we don't utilise them well at all, or there aren't any in the team. Time now to see another clip, this time from Wuchopran Aboriginal Health Service, up there in Cairns, about how Aboriginal health workers form a core part of their services.
Every client seen at Wuchopran here in the medical clinic is seen initially by a health worker.
There you go.
And we call it screening, but it's much, much more than that.
Hi Noel, my name's Bruce, I'm one of the health workers here. What can we do for you today?
I was just asked to come in for some checks, some tests, blood tests and that, to see if I'm diabetic or not.
Oh, no worries. We'll check your blood pressure and blood sugar and your weight.
There's the gathering of medical data, but there's also the gathering of information. Often that information is, shall we say, more subtle or more private or more culturally appropriate than would be perhaps understood by a non-Indigenous caregiver.
A bit up today. Just jump on the scales here.
All right.
I got his story from him and why he wanted to see the doctor, and I also discussed with him what else we can do for him, what other services we can offer. So it's a good idea to get checked.
Wuchopran has always believed that the health workers are front and centre to healthcare. They tend to be the first person to speak to the client. They're also the first person that the clients will turn to if there's some confusion or they need further clarification and so on. And then in our model here, they're also the last person that they speak to because they're the people that are organising their follow-up and their transport and their recalls.
Do you have any family history of diabetes?
I've no idea.
There's a good chance you do. I mean, Indigenous people do have a high rate of diabetes and things like high blood pressure. And I also noticed that you've been referred to the diabetes educator.
Oh, yeah?
Yeah.
When we go down to see the diabetes educator, will you be coming down?
Yeah, no worries, that's not a problem. No.
But you know, because I'm not sure what questions I should ask him.
No,
that's okay?
Yeah, that's fine.
Yeah, good.
Richard, Dr. Vlad Matic up there at Wuchopran, he talks in that clip about how Aboriginal health workers are able to get more information. He talks about medical data versus information, by which I think he means cultural information, sensitive information. Is that the experience that you too have had?
Look, indeed. You know, it's just about having an understanding of the local context. It's very, and also how you might efficiently use the skills of your healthcare team. So if you're running a busy primary healthcare clinic, you don't want doctors spending a long time trying to extract information they probably don't really fully understand and maybe haven't got the ears to hear. And this is where the teamwork really comes in, you know, being able to bring the prior knowledge of the community context, being able to bring that to the decision making so that the best possible decisions are made. And also, I really like that clip. I think the fact that clearly, you know, the young male health worker, you know, who's got a lot of confidence, who's building his skills and abilities on a constant basis, on a patient by patient, is absolutely the right way for any primary healthcare team and any professional to be working together.
Jenny,
it's about health services having good, firm policies around the Aboriginal health worker being the first point of contact, and as we've seen in some of these videos, the last as well. So,
Jenny, can I ask you, the culture at Wuchopran, I mean, this clearly seems to value the work of the Aboriginal and Torres Strait Islander health worker, but it doesn't always happen like that. Why do you think other services don't see the value of Aboriginal and Torres Strait Islander health workers?
I guess it's because it is the diversity of the roles, and I think it's part of our job as Aboriginal health workers that we need to be role models, and we need to encourage other Aboriginal people who are working in health, because it's there in their spirit, in their lian. We need to encourage them to do it and be able to talk up as well. So it's about encouraging our mob to talk up and be confident in what they do. And I think education programs like this, for example, are very, very important for non-Aboriginal people to understand the roles and responsibilities of Aboriginal health workers.
You would have seen, though, in your time, teams where it wasn't being recognised, where the role wasn't being valued and the skills and expertise of the Aboriginal and Islander health worker wasn't being recognised. I mean, what can be done in that situation?
Boy, we do see a lot of Aboriginal health workers being de-skilled, particularly in their clinical skills that they've learnt. And I think it's really important around making sure that Aboriginal health workers are part of that primary healthcare team, and making sure that we're changing the culture of the way we do business, particularly for Aboriginal and Torres Strait Islander people, because that way it's culturally safe then. And I think for mainstream services, there needs to acknowledge that the Aboriginal health worker is absolutely an important role and place in the total care of the health of the Aboriginal people's health.
I think we need to make a distinction too between community control versus mainstream. I mean, Aboriginal and Torres Strait Islander health workers seem to do better in community control than they do in mainstream services.
And as Jenny said, it's about familiarity with the role, so it's important that mainstream services do encourage employment and set target rates for employing Aboriginal people, and becoming familiar with the role. And
with training, Angela. With training.
With training.
Because often they don't, have training or not encouraged to train, and they don't. Their degrees are not always recognised, because if you're looking for, regrading, forget it. And I was only a senior Aboriginal health worker on the ARDAC study, but when I came back to work with the families after they deleted my role, they took the senior title off me, and then you go down in pay, but there's no justification.
Just a comment on teams. I've been in a position where, as a manager in a region, an Aboriginal health worker manager in a region, I've seen highly functional teams that are working really well together, and you can almost pick the things that make that team strong. It's a good understanding by the manager, who's generally a nurse that's come into the community from outside, and they've got, the compassion. They've sat back and they've actually learnt about the community. They've learnt about the role of the health worker, and about the the systems and that in that workplace. And quite often they're really highly functional teams. And then you can go to another community and that same teamwork isn't there. So, you've got to sit back and say, well, why doesn't it work with that place and it works over here? And quite often it can come back to the manager and about the team, about the manager not having the same, compassion, the same knowledge about the role of the practitioners or the health workers and the community. So it does having a whole lot of different factors impacting on that team, And often if the high functioning manager in that team, the manager leaves and someone else comes in, you'll notice that they'll be operating at a very high level, and then the manager leaves and a new one comes in. They come in down here and they drag the team back down to where they were. And with some of our health workers over the years, they've seen this not day in, day out, but every year they might have a different manager, and every 2 years, and sometimes they get sick of that, so they vote with their feet, and which is what we don't want to happen. We want to keep strong teams and that in place.
We've got some questions from the audience. Is anyone doing anything about the differences in state legislation that are limiting health practitioners in their scope of practice? That's from Bruce at Woodchopran. So the differences in state legislation, Peter, is there a discrepancy between in the law governing the work of health practitioners?
Probably the main one that's impacting at the moment is the Poisons and Dangerous Drug Act in various...
This is the administering of drugs?
The administering of drugs, yeah. In the Northern Territory, as I mentioned before, we do have a strong legislation, and the health practitioners are able to practice to their fullest. But in other jurisdictions, they're sort of restricted by not having the legislation in place that helps them to do that. There is national projects at the moment to look at harmonisation of legislation. There's other projects around prescribing for non-health practitioners and for other practitioners who don't have it at the moment. And that's been looked at and worked on now.
Another question, I think we've possibly answered this one, but I'll ask it anyway, from Gail in Tamworth. Do Aboriginal health workers need to become registered to be health practitioners? Yes, they do.
Yes, but you can't use the title Aboriginal Torres Strait Islander health practitioner or Aboriginal health practitioner or Torres Strait Islander health practitioner are the three protected titles under national law, and it's illegal to use those titles. But going back to the workforce itself, I think if you're doing a practice that can endanger, a member of the public in that practice, I think you probably should be registered. And there are some practices out there that you'd need to have, specific training around and skills. But as Richard mentioned before, you have to be careful that the practice they're doing is one that needs to be regulated as well. There's one thing you don't want to do is over-regulate.
Of course. Richard, can I ask, why do you think some non-Indigenous health professionals don't recognise the role of Aboriginal and Torres Strait Islander health workers? I think you'd be in a position to know why it is some people don't value the role.
I think a lot of it's just straight-out ignorance. There's not a lot of bad intentioned people out there. Mostly, health professionals are trying to do the best they can for the patients they're looking after. But they're uncertain, and they've been exposed often to particular industrial models within their own craft group, medicine, nursing, or subsections thereof, and are uncertain about these people who seem to be doing things and are not quite sure how that fits in. So I think that's part of it. It's probably the major part, actually. There's a little bit of risk aversion, maybe, in relation to, well, is that legal? Could I get sued? And of course, there is no getting past everybody's duty of care, including Aboriginal health practitioners, to be applying best judgment and to be appropriately prepared. And so a lot of this is about providing a system of quality and effective practice. You know, standing orders, guidelines, review of position descriptions, supervision arrangements, delegation, you know, where you're happy for people to do certain things but they call you if there's something that's outside of that. And all of these things being worked out in the workplace is part of, and more broadly now with registration, with Poisons Act reform, as Peter said, is part of providing a broader framework. It goes right, you know, from the legislative level down to the you know, level of the individual practice.
Is there discrimination and racism going on?
There is. I'm wearing my star badge, my Stand Together Against Racism in Healthcare, a great concept. I think you have to speak and name and understand and recognise racism. Mostly I think though it's not racism at the level of the individual, it's something deeply seated. I think what we mostly see is institutional racism, you know, a culture that develops in a often highly itinerant health professional environment where people are turning over frequently, when the language becomes maybe, you know, why did they let their kids get like that, or why didn't they come earlier? And this sort of language, you know, enters the workplace and becomes the norm, and that's really the basis, I think, of a lot of discriminatory practices in healthcare, rather than people having some sort of, you know, deep-seated, you know, nastiness to them. I think that therefore the challenges around providing, so for instance the cultural safety training gives people a different lens. I think even more importantly, if you can make the delivery of healthcare with and from the community rather than to the community, and this is really surely where the Aboriginal health worker role really comes to the fore, you know, because it's more than just the provision of effective care. It's people having a sense that they can control their own destiny and shape their own lives and those of their kids, you know.
Absolutely.
And it draws that line between acute care and primary health care, and you know, doctors and nurses are very much trained in acute care. Fortunately now primary health care is developing a real focus,
that's a really good point.
And it's that holistic primary health care. You know, jargon, we hear it all the time.
The only profession trained entirely in primary care.
Yeah, so there you go.
We do have some poll results. Do you think the team you work in fully values the role of the Aboriginal and Torres Strait Islander health worker or practitioner? 14% of you said yes, they are an integral part. 43% though said not fully. They're in the team, but they're not utilised to their full potential. 7% said no, they don't utilise their skills well at all. And 36% said there aren't any in the team. Wow. And the next poll question, if your view is that Aboriginal and Torres Strait Islander health workers are not being fully recognised and valued, in your experience, what do you think is the main reason for this? Is it no recognition of the need for cultural expertise in the team? Is it the lack of understanding of their role? Is it no funding to employ any? Is it that there's no position available? Is it that there's not enough Aboriginal and Torres Strait Islander health workers? They would like to employ one, but none available, or is it something else? What do you think needs to be done to improve the situation, Richard? I think it's a fairly broad question, but quite targeted. What can we do so that we can make this much easier for our health workers?
I mean, you know, if I can speak maybe just from a doctor perspective, I think doctors can really play a very effective role in advocating for and expanding Aboriginal health worker roles and have a responsibility to do so. I think that teaching, you know, as I say, every patient encounter is a teaching and learning opportunity in both directions. And should be used and regarded as such. And a point I think Peter made, that you know, that no doctor should be leaving any healthcare team with less skills than what they found, and so I think that's particularly important. I think also a role for doctors in teams is working with everybody, but also having people's back from a technical point of view. So there's a sort of contributing medical expertise to the team, and people feeling comfortable that someone's got their back. That when there's a tough one, there's someone you can go to. And that is, you know, so I think these are really important cultures to bring to the workplace, and a particularly important role, I think, for doctors.
Angela, what can an employer do in this situation? You know, if you were speaking to the chief executive of a local health service, what would you ask them to do to, I guess, improve these kind of relationships that we need?
Well, certainly recognise the role. I think Richard's talking about, you know, he's referring to medicos, but we need to look at true multidisciplinary teams, of which everybody has an equal part, and that's where with the Aboriginal health worker registration and the recognition as a profession, that will certainly assist that process. And it's about knowledge and understanding. Again, when we talked before, we talked about ignorance, and unfortunately there's still a lot of people that are ignorant, and that's not being disrespectful. They may not have had the opportunity to learn, but it's our mandate to educate and get the message across.
Jenny, can I ask you, is there one specific thing that you'd like to see changed?
I think, recognising Aboriginal health workers for what we are, registration is one step. And I think it's, education programs like this and the fact that Aboriginal health workers are standing up now nationally as an Aboriginal, health profession, I think is one of the key things. Registration is definitely the key one, because then we're considered to be real professionals.
I mean, there was that report, Peter Panqui, who says, the Growing Our Future report, which said that Aboriginal and Torres Strait Islander health workers weren't always fully empowered to deliver their role. I mean, what can we do to make sure that our health workers are empowered?
Look, I believe that, other health professionals need to really get behind this profession and push this profession. I think employers need to get out there and really look at the value. Why do you want a health worker, and actually emphasise the fact that this is a growing profession and that we want to grow it. We want mobility across Australia. We want to be able to do what nurses and doctors do and go and work in other jurisdictions and have the same level of respect and admiration that we have for our other health professionals. Get behind the health worker profession, I think is a really key thing.
Rita, a question for you. What are the main aspects of a workplace that make it safe for Aboriginal and Torres Strait Islander health workers in your experience? How do we make our workplaces safe, culturally safe for them?
Well, we need more recruitment.
Yeah, enough of them.
There's not enough, because there's only me in the Children's Hospital at Westmead. There's only one person next door in the adult hospital. And across the country, across the New South Wales, there is just one. In some places, there's 3 or 4. Talking about recruitment, the health workers currently that are in the system now going to be retiring soon. And we've been talking about, recruitment for the last 20 years, saying that there needs to be new incentives to bring the next generation in to be trained up as health workers like ourselves, because at the end of the day, when all that happens, there's going to be a wide gap of knowledge, expertise, and who's going to fill that gap? Because it'll be a time frame to train all that as the health workers, grow and stay in the workforce.
Let's take a look at some of the responses to our last poll question as we run out of time here. If your view is that Aboriginal and Torres Strait Islander health workers are not being fully recognised and valued, in your experience, what do you think is the main reason for this? 50% said no recognition of the need for cultural expertise in the team. That's pretty amazing. 25% said lack of understanding of their role. 8% said no funding to employ any, no position available, 0%, and 0% too for not enough Aboriginal and Torres Strait Islander health workers. 17% were others. Yes, we need to look at some further resources here. There are a number of organisations who have a range of useful information available on their websites and who generously contributed their time and expertise as part of an advisory panel during the development of this program and the associated documentary, A Unique Profession. Further information can be accessed from their websites. Jenny, could you speak to this slide? NATSUA, we've talked about them, the National Aboriginal and Torres Strait Islander Health Worker Association.
Yeah, as the chairperson of NATSUA, we are on the ground rounding up membership. We're advocating for Aboriginal health workers and advocating for Aboriginal health workers to become registered practitioners.
There's the Practice Board of Australia as well, and the Registered Training Organisation Network, NACCHO is another source of information, and Health Workforce Australia, which is an Australian government initiative. And of course, the Rural Health Education Foundation website, rhef.com.au. The Rural Health Education Foundation is collating a DVD which will have a copy of this program, as well as the documentary A Unique Profession, and the extended case studies with interviews with health workers and practitioners, along with other resources from the organisations we just mentioned. It'll also contain a structured learning guide for those who wish to undertake accredited in-depth education on this topic. The DVD is available to order from the RHEF website. Jenny, some key take-home messages. One key take-home message as we run out of time.
I guess is to recognise that Aboriginal health workers play a key role in the improvement of Aboriginal and Torres Strait Islander people's health.
Angela?
Just boils down to basic respect as a non-Aboriginal nurse, and I'm talking about respect for another culture and openness to learning. We expect Aboriginal people to be learning all the time and forget that we're very task orientated. We need to learn to and always see the broader picture, always consider it in context and not just the here and now.
Peter?
Yeah, I'd like to see all health professionals promote this profession, get on board, work with Aboriginal health workers, Aboriginal health practitioners, and if you think you've got Aboriginal primary health care and you don't have Aboriginal health workers, you don't have primary health care.
Mm-hmm. And Rita, yours was recruitment.
It was a recruitment, yes. I mean, I did say that, but at the end of the day, it's about time we started respecting the difference.
Richard?
And I think, look, take-home message, dispel the myths. There are no barriers to flexible team-based care, where everybody contributes and you have a comprehensive model, and just embrace that as your practice approach.
Thank you. Now, if you're interested in obtaining more information about the issues raised in this program or would like to watch this program again, please visit the Rural Health Education Foundation website and click on the A Valued Profession Program webpage. Now, if you are a health professional, don't forget to complete your CPD evaluation form, which can be completed online. You'll receive a certificate of attendance and, if eligible, CPD points. Our thanks to Health Workforce Australia, an Australian government initiative, for making this program possible, and to all those organisations and individuals who've contributed to its development and who've generously shared their stories with us. And our thanks to you for taking time to watch and contribute to our discussion today. We'd appreciate your feedback on the program. Your comments are very important to us. Let us know you watched the program by sending us an email or a text, and feel free to share your views. We'd love to hear them. I'm Daniel Browning. Goodbye, and join us again on the Rural Health Channel. The Rural Health Education Foundation is producing a DVD which will have a copy of this program, as well as the documentary A Unique Profession and the extended case studies and interviews with health workers and practitioners, along with other resources from the organisations we just mentioned. It will also contain a structured learning guide for those who wish to undertake accredited in-depth education on this topic. You can order your free copy now by going to the RHEF website, rhef.com.au. The Rural Health Channel broadcasts 24 hours a week. To see what other programs are showing tomorrow and for the rest of the week, jump onto the Foundation's website and click on the RHC TV guide on the left-hand side.